Hi everybody. In this video we are going to discuss about the cancer. Okay, we are going to discuss about the cancer. In the previous video we studied about the cancer and the causes of cancer. And now in this video we are going to discuss about the cancer detection and diagnosis. Okay, cancer detection and diagnosis. So here, how when a person is being attacked by cancer, he or she may not be identifying in the early stages. Most of them, okay, are not able to identify this particular disease in early stages. So if it is, okay, suspected that it is a cancer, how it will be detected and diagnosed, we are going to see in this video now. So now the first thing that they do is, once it is been, okay, suspected that it is a cancer, they go for the first test called as biopsy. Okay, called as biopsy. So biopsy is a diagnosis that is done to detect what? Cancer. Okay, biopsy is a diagnosis that is done to detect cancer. So in biopsy, what do? They will cut the suspected tissue. Okay, they will take the suspected tissue into thin sections. Okay, into thin sections, and they will use stains. They will use different stains. So if this is a suspected cell or a tissue, okay, tissue, they will take it and make it into thin sections. Okay, they will make it into very thin sections, and they will be adding using some stains. Okay, some stains, and observe this particular tissue or the cells under the microscope. Okay, that we call it as what? Histopathological studies. Okay, histopathological studies of a tissue. They will be examining it under the microscope. So they use microscope to see this after adding what? The stain. Okay, particular specific stains will be there, and they add it, and they may determine by using these stains using microscope. They will see it under the microscope. This we are calling it as histopathological studies. Okay, we call it as what? Histopathological studies. Okay, histopathological studies. Okay, where a pathologist, okay, where a pathologist will be examining this tissue or the cells which are made into thin section cuttings. Okay, and he will decide whether it can be cancer or not. So such that is that type of examination is called as what? Biopsy. Okay, that is called as biopsy. And there is also another one which we call it as what? Blood and bone marrow test. Okay, blood and bone marrow test. In some cancers there may be increase in the count of blood cells. Okay, increase in count of blood cells. Okay, count of blood cells. So in such cases they will be checking out the blood and also the bone marrow. Okay, they will be examining the blood and bone marrow for increase in count of blood cells in a very important disease like leukemia. Okay, in a very important disease like leukemia, they will be going for what? For counting the increase in number of blood cells by taking a blood and bone marrow. So this is also another way how they will diagnose and detect the cancer. Okay, diagnose and detect the cancer. And for detecting cancer of internal organs, okay, for detecting cancer of internal organs means there are all the organs, okay, all the organs where when they are infected with or attacked by cancer, okay, attacked by cancer. When I say that it is all the organs, see, there is also one organ in our body which may not be attacked, okay, by cancer, and very rarely we will be seeing this particular organ attacked by cancer, that is heart. Okay, that is heart. But otherwise most of the organs are attacked by cancer. Okay, so we are talking about the how to detect cancer, okay, of internal organs. So what are the instruments that they use to diagnose and detect the cancer of internal organs? So here we are saying radiography. Okay, radiography. So here in radiography what they do is they use X-rays, okay, to detect the cancer. So radiography is one technique to identify cancer. In radiography what they use? They use X-rays, use of X-rays. And there is another one, CT scan. In short we call this as CT scan, we call it as, okay, CT scan they say. This is computed tomography, use of X-rays to generate what? 3D image. Okay, in computed tomography what they take is they take the 3D image of that particular organ, okay, of that particular organ which is suspected with what? Cancer, and they study about that particular, okay, organ, whether it is been affected with cancer or not. And the next one, and a very important one, is magnetic resonance imaging. Magnetic resonance imaging. In short, we call it as MRI. Okay. In short, we are calling it as MRI. So in MRI, what they use is they use strong magnetic fields and ionizing radiations. Okay. Ionizing radiations. For what purpose they are using magnetic fields and strong ionizing radiations? For getting the accurate, accurate information, to detect the accurate information about that particular organ, about that particular organ. It will be when you are using a magnetic resonance imaging, when we are going for MRI, it will be giving you and detecting the pathological and physiological changes in the living tissues. It will give the information. MRI scanning will be giving the information about the pathological and physiological changes in the living tissues. So this is a very best method, best diagnosis that is done or used for detecting what? Cancer, for detecting the cancer. And another one is that they will also use antibodies, they also use antibodies against the cancer specific antigens, they also use antibodies. And moreover with the sophisticated equipment that we have now, advanced equipment, now they are also using techniques of molecular biology, they are also using the techniques of molecular biology. So by this technique called as under the molecular biology, they will identify or they will detect the genes responsible for causing the cancer. As we said that every individual will be having the genes that can cause cancer, but the only thing is that when they are exposed to certain drugs or chemicals, they will try to cause cancer. So in advance, what they do is they will detect the genes in individuals with inherited susceptibility to certain cancers, to certain cancers. Means what? If their four ancestors, with their parents or their forefathers, if they are suffering with cancer and died, if it is suspected that they also may be carrying that particular gene, they will try to identify whether that gene is in active form or inactive form with the technique called as molecular biology. So once it is being detected, that particular gene, once it is being detected, they will be advising, they will be counseling those people to not to be exposed to the drugs or those chemical substances which can stimulate those genes causing cancer in future, which can cause cancer in the future. So once it is being identified, we should remember what now? They will be advised not to be exposed to those chemicals which can cause cancer. So like for example, you can take tobacco, tobacco, and this can cause what we said, lung cancer. So lung cancer. So those people who are having who are suspected that they may suffer with cancer, they will be advised not to go for what? Smoking, not to go for smoking, because if they go for smoking, the chemicals in the tobacco can cause lung cancer, lung cancer, because those chemicals, what do? They go and stimulate the genes present in the body and lead to cancer. So that's why they will be counseling those people. So now, if you are looking at the treatment of cancer, once it is identified that it is cancer, what they go for is they go for surgery, which means they will identify the cancerous cells in the body and they try to remove those cancerous cells by surgeries. By surgeries they will be removing the cancerous cells from the body. But please remember, it is not guaranteed that all the cancerous cells will be removed. All the cancerous cells will be removed during the surgery. Even if one cancerous cell is there present, it can easily multiply, divide repeatedly, which means proliferates and grows, and again it leads to severe cases called again cancer. It leads to again cancer. So here we cannot give much guarantee for surgeries, but the first treatment for cancer is they will go for surgery. But otherwise, they also go for what? Radiation therapy. Okay, radiation therapy. Here, in radiation therapy, what they do is tumor cells, which means cancer cells. Tumor cells are irradiated lethally, means they are confined, they are completely destroyed. Okay, they are completely destroyed by exposing the cancerous cells or tumor cells to what? Radiations, like X-rays we are saying. Okay, so the rays are released. Okay, these rays, X-rays, are released on the tumor cells and they will be destroyed. Okay, they will be destroyed. And the other one is chemotherapy. Okay, chemotherapy. There are different drugs for different cancers. Okay, there are different drugs for different cancers. Means there are different medicines for different types of cancers. So they give the drugs to kill the cancerous cells. Please remember, those drugs which are given will be targeting the cancerous cells only. These drugs will not try to destroy the normal cells of our body. That is very, very important in the chemotherapy. So in chemotherapy, drugs to kill cancerous cells only. They are specific cancerous cells will be destroyed, not the normal cells. So normal cells will not be destroyed, should not be destroyed when they are going for what? Chemotherapy. So chemotherapy means what? Chemicals, means medicines, or otherwise we are calling it as drugs. Okay, chemotherapy. So drugs are given to destroy the cancerous cells. Okay, that is another one. And please remember, most of the cancers, most of the cancers will be dealt with the combination of these three. Okay, with the combination of these three called as surgeries, radiation therapy and chemotherapy. Most of the cancers will be dealt with all these three togetherly. Okay, all these three togetherly. And moreover, please remember, when a cancerous person goes for chemotherapy, there are side effects. Okay, there are side effects. So there are side effects like they may show hair loss. Okay, they may show hair loss. Okay, they may show hair loss, and even it may lead to anemia also. It may lead to anemia. So these are two side effects. Okay, these are two side effects of a person who is going for chemotherapy. Okay, who is going for chemotherapy. Please remember that. And now here another one is immunotherapy. Okay, the last one is immunotherapy. Here, very important point we have to remember is that the cancerous cells, which are multiplying and causing damage in the body, they will be avoiding detection and destruction by immune system, which means immune system cannot easily identify the cancerous cells present in the body, because the cancerous cells will try to protect themselves from what? The immune system. Cancerous cells will try to protect themselves from the immune system. So in simple we are saying the cancerous cells avoid detection and destruction by immune system. They will not give much chance for the immune system to attack and destroy the cancerous cells. That's why there is another treatment which we are calling as what? Immunotherapy. In immunotherapy, they will be administering alpha interferon. It is also known, it is a biological response modifier. Please remember this. Biological response modifiers. Please remember. Name the biological response modifier means you have to remember that it has alpha interferon. Alpha interferon, which is a biological response modifier, activates the immune system of a person. Activates the immune system of a person to destroy the tumor cells. So we have to remember that tumor cells can be destroyed by what? Alpha interferon. Alpha interferon. Please remember this. So these are all the way the treatment is done for the cancer cells or cancer patients. Here the first one is what? Surgery, radiation, chemotherapy. All these are the three combinations. 1, 2, 3 are the combinations for most of the times. These are the three combinations that they follow for treating the cancer. But otherwise they go for immunotherapy by administering alpha interferon. Which is called as biological response modifiers. So these are all the points that we have to keep in mind when we are discussing about the cancer. Thank you so much.